you. Very nice.
Great. Okay, how many people do we already have?
You can see the number on the screen, Paul.
45. Yep, I see it. I just had to.
Yes, it's 45 at present participants, so we're expecting more soon.
Good evening, everybody. We'll start in a few minutes. Thank you for your patience. Please bear with us. We had many people sign up, so let's give them maybe 2 or 3 minutes more before we start. Thank you.
Thanks, Roy.
Anil, can you hear me?
Yes, I can. So Narayana, where are you? Longwood?
No, I'm Florida, Miami.
Okay, all right. Well, it's 70 degrees today in Boston also. Not humid.
I'm heading to Dominican Republic, so for a few days to do something, and then I'll be back. I cannot hear you, Anil. You're muted.
Have you been vaccinated?
Oh, yeah.
Yeah.
Oh,
So
I
think then we should meet at in Longwood at the Brigham and Women's medical school area.
Yeah,
Because I got 2 months ago also, but I come to BI quite frequently.
Okay. Did you get Pfizer or Moderna?
I got Pfizer actually at a Jewish temple through federal government.
I don't know if we can pick a choice. I don't think.
Whoever get Moderna at home or my friends and family had a lot of issues.
Hello, do we have Dr. Greg in?
I don't know what's happening. Yeah, he is normally the first one to join.
So he's facing some issues. There's some trouble. Let me check it again, sir. Let me check it.
Yeah.
Yeah, we're just doing very good. 135 million vaccination. More than 35% of population have been vaccinated.
Right.
That's a very good news.
So very soon they're going to start vaccinating kids also.
Yes. Yes.
I think the group between 14 and 16.
Yes.
So now this webinar is also streaming live on Facebook.
Perfect. I think we should start soon. We've got almost 60 people, so without further ado, I probably can start the session. Would that be okay, Anil?
Yes, I think we should, and hopefully Greg will join, or at least he'll get to the technology part before he speaks.
Very good then. So good evening to everyone who is joining us from all over the world. We are at about 60 participants right now, and we expect more as the session unfolds. I'm speaking to you from Bangkok. My name is Roy Wadia, and it's wonderful to be the moderator of what promises to be a truly special session. As you've seen from the advert that was promoted, this is a special event being held on a special day. It's World Health Day. And the theme of World Health Day, which is of course set by the World Health Organization, is a healthier, fairer world. And the subtext of that is health equity and health for all. And this comes, of course, more than a year into the COVID-19 pandemic, one of the most unprecedented crises of our times. In fact, the Secretary General Antonio Guterres has said that this is the world's worst crisis, the most formidable one since the end of the Second World War. And I don't think it's truly any exaggeration to say that each of us on this call, in one way or the other, has been, I would say, impacted. Some of us have actually lost family, friends. Some of us have actually had COVID-19 and fortunately survived, but may still be feeling the long-term impacts. And so it is a crisis that is still unfolding. Of course, there is light at the end of the tunnel. It's getting brighter all the time because we've got vaccines. But as you know, the vaccine rollout has not been very even. In fact, the head of the World Health Organization, Dr. Tedros, has said that countries holding vaccines, countries not sharing their stocks, countries not thinking of the world as a whole, are acting very selfishly. And so there is a call for, shall we say, vaccine equity, and that feeds into the theme of World Health Day. So it's a truly opportune time for us to mark the importance of partnerships, and partnerships specifically in global public health, partnerships in saving lives, partnerships in helping carve out new pathways to health for all. And that's why we have brought some truly important players, stakeholders together, the sponsors of this evening's event, JSPH, Purnima, and the Empower School of Health. Now, we'll be hearing from several people as well beyond the hosts, people who've had fantastic public health careers. And the aim of hearing from them, hearing their own stories, is to inspire many of us on this call who may be having aspirations to entering the field of public health ourselves. And before I end my opening spiel, let me just say that the phrase public health is one that has truly expanded over the last 20 to 30 years. The definition has been expanding all the time. There have been new strands added on, and the speakers that we will be hearing from exemplify the breadth, the spectrum of public health. So without further ado, let me turn to Dr. Anil Burrowhead, the founder of the Jodhpur School of Public Health. And he's done so much more than that, of course, throughout his public health career, joining us from Boston in the States. Anil, over to you to set the tone, please. Thank you.
Thank you very much, Roy. Good morning, good evening, good afternoon, wherever you are globally. I'm privileged to be on this panel and co-host. I would not take much of your time because you've got all these experts who will talk about the global health and how we can all work together. But I'll give a brief description of my journey in global health and Jodhpur School of Public Health. Where did I begin and where am I now and where I want to go along with all of you. I started my undergraduate education in Boston at Northeastern University and pre-med at Harvard University. And at that time, all of our friends, students, classmates would travel to either Africa or Asia to learn public health. And originally being from India, from Jodhpur, I always felt that there's so much public health in India, and in the US, we confer degrees, but we do not do any global health, public health. And interestingly, no schools of public health in India at that time. That was early 2000. I had enrolled myself after my undergrad at Medical College of Ohio, an MD PhD program. And part of my research was something to do in a developing country. So I had been traveling to India since I come from there. I have got a family over there, and uh, learned a lot about tuberculosis, malaria, which we never used to talk or see in the United States at that time. But now the work has become more global, and the globalization brought a lot of people together. So I was in India once, and I talked to quite a few doctors, and they said we have a lot of international students, mostly from the United States and United Kingdom, coming here. So fortunately, while I was in my PhD part of the curriculum, I had come in contact with a countess from Switzerland, and at that time she had just endowed a chair for Jonathan Mann, I'm sure most of you know, on health and human rights at Harvard. And interestingly, in '92, when I was in my undergrad, Boston was supposed to host the World AIDS Conference. But our president at that time, senior George Bush, had decided no HIV conference is going to be held in the United States. And sadly, with a 1 month's notice, it had to move to Amsterdam. And normally at this Congress, there are 30 to 40,000 people. And I had a presentation comparing different body fluids in HIV patients. And it was my first presentation and was accepted for a poster and then oral. So I traveled to Amsterdam. And when I went to Amsterdam, I felt that me coming from developing country, there's so much to do in public health. Medicine is, something everybody does, but with public health, you could educate the whole village, the whole country, the whole town. And so I come back while I was working on my thesis and spoke to my advisor at Harvard Medical School, and I told her I don't want to work in the research lab because part of my project was doing in vitro fertilization and HIV, mostly basic science, and seeing andrology patients for test tube babies and in vitro fertilization. So she said, no, you continue. You can definitely, start something on HIV/AIDS here. So I started to work something on HIV/AIDS awareness at Brigham and Women's, where Narayana is, but then we had moved to Faulkner Hospital in the nearby area. So that's how I got into HIV/AIDS. But then, as I said, I came across the Countess. There's a building endowed in Harvard University, a School of Public Health, FXB, Francois Xavier Benio. And the Countess, the founder, Countess Albina, she and I were traveling from Sumerpur in Rajasthan, a very small rural village, you could say, or town now, to Jodhpur. At that time, I had small funding from Bill and Melinda Gates Foundation. And interestingly, that was the first ever funding they had given to India on HIV/AIDS, around $500,000. That funding was from 1999 to 2002. And I told her that, India, 1.2 billion population and no schools of public health. And she said, why don't we start one? Of course, we could have put the money together, started a school, but again, to start is not easy. There's a lot of bureaucratic layers you have to pass through. So we started putting some money aside, and somehow it did not work. But later on, I was in New Delhi at one of the head of the state, I could say, or chief minister, Sheila Dikshit at that time, at the India Economic Summit through World Economic Forum. And I came across a gentleman who was the dean of Raffles College, and he was Raffles University in Singapore, and he was leaving his job and going to Dubai to work for a sheikh. So I asked him, what are you going to do for sheikh? He said, I have $1 billion to work on education. And so I floated my idea about public health. He said, no, we don't want to do public health. We don't want to get into medicine. So I explained to him, it's not medicine. What public health is very different. So he invited me to Dubai. I flew to Dubai. We had a very good discussion. And unfortunately, the economic turndown came. So Dubai was almost bankrupt. And so I did not give up. Then later on, one of the family friends, physician, Dr. Arvind Mathur, my mentor, he and I were discussing, he used to see HIV patients. I was in the clinic at 1:30 in the morning. He said, why don't we start one? So we started with 3 students, totally tuition-based, very, I think, little amount, probably one of the most inexpensive schools of public health on the planet. Started with 3 students, and today we are working with 2 universities. One is Purnima, which is a partner on this World Health Day, with us hosting this important webinar, and other one is Maulana Azad in Jodhpur. And so as of now, we have conferred around 570 degrees. This is where my transition from working in health area, in clinical medicine, in clinical research, uh, got into global health. And very interestingly, I think so much we've learned from Jodhpur, from India. And next phase of my life, I had mostly worked at Harvard Medical School and then FXB. But then the University of Washington had hired me to go to Chennai, India, to set up a HIV fellowship for clinicians, mostly for medical doctors. I was there for 3 years, and the end of the third year, the federal government of the United States, which is part of the PEPFAR, uh, President's Emergency Plan for AIDS Relief, had traveled to Chennai to evaluate my program. And they offered me a job to work in the US government. And the sole reason was that what I did in India with my team, of course, you cannot be a leader, you cannot be a team player unless you have a good team. And so my team was fantastic. We did wonderful work. We got very good rating. So Federal invited me to come to Washington and work for them. So the point here is that global health is so important uh, because you learn from each and every one. What happens in one country affects another country. This is what we are seeing in COVID-19. This is what we saw in AIDS. And there's a lot to learn in global health, a lot to do. You don't have to be a physician. You don't have to be a scientist. I think everyone has a role to play. Whether you're a social worker, your engineer, your doctor, your businessman, your chef, whatever, everybody has some role to play. And this is where we are today with the global health, and it has become very important. Plus, we at Purnima University, in partnership, we run a master's program in public health with focus on global health, including nutrition, but global health is one of the disciplines. So I would not take much of your time, but I just want to emphasize that we all need to work together. And Empower is doing wonderful work. Empower, Paul will be talking about it. And here the partnership begins because they have very good footprint in Africa, Latin America. We are locally in India. And I think with all of us together, there's so much to do, and still it's not enough. So I would stop right here and give it back to my colleague, my friend, Roy Wadia. And thanks for having me.
Thank you so much, Anil, for that personal story and for setting the tone for the wonderful session that we have for the audience right now. We are going to switch the order of speakers a little bit, and I will now turn to Dr. Paul Lalvani, who is the head of the Empower School of Public Health and the Center for Digital Learning. He's actually in Phuket in Thailand, not too far from where I am. And Paul, we are actually celebrating your school as well, the partnerships that you have forged with JSPH. And please, over to you to take it further. Thanks.
Thank you very much, Roy, and thank you, Anil. Can you hear me okay? Could I just get a thumbs up? Yes.
Absolutely.
Perfect.
Yes,
thank you. So just before we go into my presentation and my talk, what would be helpful is to understand the audience. And for this, we've put together a poll which will require all the audience. We have about 80 plus folks now to have quick, short responses. I imagine there'll be more people coming on, but we'll continue with this anyway. It'll give us a background about who you are, and at the same time, it will allow us to then customize our messaging as well. So could I ask the admin team, Sonia, Rahul, if you could launch the first poll? And when you do that, yeah, perfect. Quick, short responses. What is your gender? What is your age, etc. And if you scroll down, you'll see a few more questions as well. So. And when you're done, if you hit submit, it'll give us an idea. Normally it takes about 60 seconds for each of you, and by the time everyone's done, it'll be about 2 to 3 minutes. Okay, and we're off. And team, when we hit about 70, 75%, we can pretty much pause it. Okay. Oh, sorry, I don't. Did the poll stop?
We're now seeing
Could I
the poll
just ask?
results.
Yeah, did the poll stop? Attendees are now viewing the poll results, it says. I think it stopped prematurely. Do you know how many people responded?
So it shows 31 people have responded.
Yeah, so less than half. You know, let's. I do apologize. Rather than waste time, we can just. Okay, we just relaunched it. All right, I think it'll go much faster. Why don't you quickly, if you could please do that. Sorry, it'll take another couple of minutes.
Meanwhile, I would request all the co-hosts not to click on the end polling button because usually we are compelled to when we see a button to click it. So,
right.
I mean, just to be safe.
Right now, we're just seeing some of the pre-results. What's interesting is it's almost 50-50 male-female, which is, so the gender balance is pretty good. Age, less than 30 seems to be the mode, at least at the beginning, which is interesting. And a lot of people from obviously Southeast Asia and from Sub-Saharan Africa. So we seem to have two sort of focal points. And again, lots of folks with bachelor's and master's degrees as we move forward. And many of them in pharmacy was probably one of the highest. Okay. All right, we're at almost 45%. Well, so far it looks like there are more women than men. I think we might have overdone it here. Excellent. %. We'll just wait another 30 seconds and then we can pause it. I don't see the numbers moving, so let's just end the poll. It's okay. So the gender balance, 50-50, less than 30, which is good. The youth, well, from my point, it's the youth, are the largest majority here, which means plenty of opportunity to learn, to grow, and to reposition your career. Sub-Saharan Africa and Southeast Asia are the two big blocks where most of the attendees are from. Academic background, medical sciences, pharmacy, management all have some significant presence. Majority of the audience has a master's, some with PhD, obviously most with bachelor's as well. And where they're working, also very interesting, Ministry of Health, about 1/4, international NGOs, private sector, and others, about 1/4 each as well, some from the UN. Okay, so this is the audience, and we'll also get to know each other as well. We can stop sharing now, okay? So let me, if I could ask you to share my slides so I can put the context behind this particular partnership and presentation as well. And the whole focus, Anil and I, we go back a few years. We met and we have a common passion, which is large-scale capacity building and creating impact. And both of us have been focused on targeting, working with folks from the Southern Hemisphere while we've been lucky enough to have the opportunity to study and work in the Northern Hemisphere, working with UN agencies or federal governments and what have you. So I personally grew up in India, Nigeria, the UK, and then studied in the US. So I'm as much African as I am Indian in my youth. In fact, my parents are still living in, my father, my brothers are still living in Nigeria. So, and I was actually married in Nigeria as well. So Africa is my home, India is my home, and currently in Thailand. So Empower School of Health is about 12 years old, and our emphasis and focus is on transforming the way people learn, work, and save lives. Next. Basically to say that large-scale learning and capacity building, and in fact was a request from one of our participants and students about 10 years ago when he had asked, could you help us get better, get stronger, without us having to invest or spend a lot of money, leave our work and job, travel to a university where we are required to go into massive debt, and by the time we come back, we can't find ourselves out of that debt. So they wanted high quality, low cost education, and that has been our objective ever since we started. And these are some of the groups that we've been working with. Next. We don't work alone. We have partnerships across the Americas, lots of them in Africa and Southeast Asia as well, universities, professional associations, etc. And many of you are part of that as well. Next. Our areas of work: global health leadership, HIV, TB, malaria, anything to do with global public health. Okay, next. One of the areas of focus, and if I'd like to bring your attention to the gentleman on the far right, His Excellency, the former President of Ghana, President John A. Kufuor. He has been a mentor for the past 5 years to our faculty members and to our students. And there have been plenty of opportunities for individuals to engage with him, interact with him. He's still an incredible gentleman and a force, even though he's retired from political life, he still stays extremely active. Next. Let me set the stage for global health, what it was and how it is evolving. And then later I'll come back when several eminent speakers would have spoken about their lives and how they entered global health and the impact that they are creating. And towards the end of this presentation, when others have spoken, I will share with you our course on careers in global health, how you can understand more about what the space is, how you can enter the space, how you can work there, how you can plan your career going forward, especially since many of you are less than 30. I drifted into this space in my mid-30s. I wish I'd had the access to the kind of speakers we have today and the kind of courses that are available. So you can get a jump start on that. So very briefly, global life expectancy, you can see it suddenly goes north towards the end, towards close to about 150 to 200 years. Massive change. So what caused it? Next. And this is really interesting as well, which shows life expectancy by country and by gender. And all of you know that developing countries tend to have lower life expectancy. You'll see many of the African and Asian nations or low-income nations on the bottom left and the richer ones on the top right. Just click one more, you'll see a line come on. Yeah. What's interesting here is the line, all the countries above the line show where women live much longer than men. And it's fascinating to see some of the countries such as Lithuania, Russia, and others where women live far longer than men. It's a very interesting graph. And again, public health, global health, The more you study it, the more you get to understand the dynamics behind it. Next. Mortality and causes of death, significant decrease from 1900s to 2010. No surprise, everybody knows that. But what's really interesting is even though the mortality rates have been compressed, look at the blue horizontal bars, which are infectious diseases, tuberculosis, pneumonia, influenza being squashed to a very low percentage. Whereas if you look at the green bars, the cancer, heart disease, and chronic diseases, they've expanded significantly. So a lot of dynamics in terms of the demography and changes in health and diseases. Again, great way to understand what's going on. Next. Pandemics, we've faced them again and again. Millions of deaths. You would have we keep talking about the Spanish flu. That's the big green, scary looking bubble on the right hand side. You've got HIV/AIDS, 25 million deaths. COVID has reached already almost 3 million as of this month. When this chart was made, it was 70,000 deaths, so massive increase. Hopefully we will be flattening the curve. So even though we saw the shrinking of the infectious diseases, here you can see that they keep cropping up again and again, very unpredictably, and we need to be prepared for this. Next. Of course, as humans, we innovate, we respond, and the discovery of antibiotics, you can see the growth from starting in 1920s. We had massive innovation, and then you can see them declining. And in the last 20 plus years, 30 years, the innovative antibiotics have pretty much dried up. And there is a significant scare that there are these drug-resistant microbes where we will not be able to address them. So again, infectious diseases, while we've compressed that bar of infectious diseases, it could ramp up again. Next. This is what the pharmacies looked like 100 years ago, 60 years ago in some countries. Next. Here's what they look like now, some nice shiny glass, marble, etc. Right? This is all, once you start to think of it from global health and dynamics, these transformations start to make sense as well. Next. And of course, everyone's seen the Sustainable Development Goals, 17 of them. In this case, it's not laid out as 17 squares, but with health in the middle, which overlaps with all the 16 other Sustainable Development Goals. Really, health is at the center of this. Today is World Health Day, and as Roy put it at the beginning, very succinctly, it is vital. Health is a human right, and we must do what we can to learn about it, understand it, and create impact. Next. I think that's the last slide. Okay. So with that, I hand it back to Roy to take it through to the next step. And I'll come back again as the last speaker. Thank you.
Thank you so much for that. Truly appreciate the stage setting, the historic look back, also some sobering facts about the fact that we haven't really found any significant antibiotics for the last
Roy, you're not. Maybe it's me, but you're not that clear. Can everybody else hear Roy? Okay.
No.
Okay. Can you hear me now?
Let me
Yes.
mute myself.
Clear now. I think somebody has their microphone on. So
yeah, if everyone can mute themselves, I think that would help Roy's microphone as well. I'm switching mine on.
Thank you so much, everyone. Yes, please keep your microphones off if you're not speaking. And for the audience that is not part of the event in terms of a speaking role, please also switch your cameras off. Thank you. So yes, so Paul, I just wanted to say thank you for that wonderful look back in time and a little bit of a sobering look ahead as well. I was also struck by the fact that you pointed out that for the last 30 years or so, we haven't really discovered any significant antibiotics. All the advances from the late 1920s until the 80s or so, and then there is a dry spell. And of course, public health deals with all of these challenges and all of these quandaries. And so with that, let me turn to the speaker who should have been second, but we placed him third. And that is Dr. Ashish Manocha, who's the head of the Department of the School of Public Health at Purnima University in Jaipur. He is a dental surgeon and also has a hospital management background. And Ashish will be sharing a statement from the Jodhpur School of Public Health, including the background of the partnerships that have been struck and which are, at the center as well of the session here this evening, morning, afternoon. Thank you. Ashish, over to you.
Thank you, Roy. Good morning, good afternoon, good evening, everyone. Myself, Dr. Ashish Manocha, and I am on this webinar on behalf of Jodhpur School of Public Health and Head of Department in Pune University. I will be sharing the slide. It's visible?
Yes.
So Jodhpur School of Public Health, and its inception was in 2008, and it became a center of excellence in offering training and capacity development in rural and urban slum public health, drug policy, human rights, tobacco control, nutrition, health, and along with academic arm. And we are proud to say that we are currently having a knowledge partner with Maulana Azad University Jodhpur as well as Pune University Jaipur. And these are some of our strengths in JSPH: the excellence, accountability, the team spirit, and equity. These are some of the courses offered and different types of you can say hybrid courses, or masters in public health, masters in hospital administration, different diplomas, different PG diplomas in epidemiology, biostatistics, PhD in public health, hospital administration, and recently we are also starting PhD in digital health. We also have courses in collaboration with Indic Chain in Pune University for blockchain, artificial intelligence, even PhD in artificial intelligence, digital health. These are some partnerships and collaborations in past and present with JSPH, and basically we are at these two places currently. Our presence is at Pune University in Jaipur and at Maulana Azad University in Jodhpur. So going forward, the School of Public Health in Pune University got established in 2019, where Jodhpur School of Public Health is a knowledge partner with it. And this partnership added another avenue in the cap of both university as well as the Jodhpur School of Public Health, as well as the health segment is concerned. School of Public Health, Pune University, Jaipur is in making the concerned efforts to ensure that the education and training imparted are at par with the global standards and local needs. Such training is necessary to address the unmet needs of such subject experts in public health as well as in the healthcare sector. We have our experienced and distinguished faculties from global, having expand the value, attitude, the ethical aspects of the field to enable the students in developing a sense of commitment to the service. Emphasis is given to health informatics within an organization, health promotion, public health nutrition, global health, which will be, you can say, achieved by different types of industrial and field visits also. So in low income countries, despite the availability of effective interventions of many priority health problems and enhanced developmental assistance, progress towards the SDGs, what Paul sir just mentioned, is impeded by the shortage of trained and motivated supported health workers. So it is essential to produce public health workforce who will have social inclination and understand social responsibility and accountability to prefer to serve at underserved and unreached areas of the society with global acumen to become a public health leader. So going forward, and we will be having a good partnership, and this partnership, I hope it is to develop competent, confident, and compassionate health personnel suited for both public and private healthcare sector, and especially for serving the rural and the underserved areas. Thank you.
Thank you so much for that, Ashish. Thanks a lot. The next item is actually the formal unveiling of a special new course, which will be of huge interest to many in the audience who want to embark on an international global public health career. And for that, I'm told I should hand it over back to you, Paul, to announce this special program. Over to you, Paul. Thank you.
No, I think what's probably best is that the speakers that have been invited give their personal story of how they entered public health, global health, and how they're creating impact. And I'll come back right at the end to sort of bring that together and how the audience can then participate in the course. Sorry, maybe I didn't make myself clear. Okay.
No problem. I was just going with the flow that was presented to me. So we'll later. So yes, so then let's move on to more personal stories, which are also interwoven with the professional track. And we have a range of truly inspiring speakers. We had a technical rehearsal the other day, and they shared some of what they will be sharing with all of you now. And I was truly impressed. So without further ado, let me turn to Dr. Narayana Prasad, who's the founder of Public Health Literacy, and he is also based in Boston. He will explain what public health literacy is. Besides that, he is also the technical director at the Cardiovascular Imaging Core lab at Brigham and Women's Hospital, which is actually affiliated with the Harvard Medical School. So Narayana Prasad, over to you. Thank you.
Great. Thank you, Roy. Thank you all. Can you hear me? Great. You know, as we hear the news this morning, and based on what I saw just a while ago, you know, World Health Day, I have to say, in United States, our president, Joseph Biden, has declared this week as National Public Health Week. So there's a lot of activities going around in the country, in this country and public health. Before I start my presentation, I do want to first say, you know, we are in an unprecedented time. More importantly, we should be thankful. You know, I want to salute all the frontline workers who's been working at a global level, all the doctors, all the nurses, technicians, and the cleaning crew at the hospitals, all the great job they're doing, trying to protect the society we are living in. And not just the healthcare workers. I'm talking about airline industry workers and taxi drivers, Uber drivers. You know, they're all taking sick people from point A to point B. So that's a impressive work they're doing. We should salute them, and that's something unprecedented. Now, going to the COVID-19, Who would ever think this microscopic monster would devastate the whole world, at least in our generation we have seen. That being said, it also giving us an amazing opportunity to look at our public health, global health in a different lens. So with that, I'm going to start sharing the lens in my slide here. So let me see if I can. Give me a second. Okay. Can you see my slide? Right.
Yes, thank you. Go ahead.
So here I am, founded Public Health Literacy, primarily came out to learn how we as human beings process health literacy at a grassroots level instead of coming all the way from experts, so-called experts, so-called scientists. Sometimes there is a disconnect. So my storytelling is primarily to tell what we mean at public health literacy, how we all could collaborate. We know the understanding is two-way traffic. I mean, there's a lot of data that suggests health literacy is a powerful social determinant. It primarily is a behavioral change that can produce good gain in persons, communities, and global health. Now, there's a lot has been written on health literacy. These two articles caught my attention. Health literacy is not just a property of individuals, it's also property of the communities. And it is intrinsically connected to social determinants of health. And there's a lot of models have been developed. Now, Australia has developed a Center for Culture, Ethnicity, and Health, and they have introduced a big project where social determinants and health literacy, how it connects to in the space of public health. More interestingly, lately, some of the leading academic institutions are started looking at public health literacy as a freestanding discipline. Tufts University here in Boston, they're running a freestanding course on health literacy leadership. Georgia State is actually running a graduate degree certificate. Here at Harvard, they're actually running an entire department on health literacy studies. That brings back to amazing academic experts are in the pool today. Jodhpur School of Public Health, Empower School of Public Health, Pune University. And I think that's where it's all going. All the academic institutions try to promote public health and health literacy as a part of a science that people could start promoting. Now, when we talk about health literacy, it comes down to a few things. We collect the health information from different sources, such as my father, my mother, my kids, my friends, all of us and the audience. We collect the health information coming from different sources. It's not just reading in the libraries. We collect the information from the internet, from the TV, from the radio, from the internet, talking to the doctors, and also social activity. And somehow we use this information to use into our lifestyle, and hence we influence the way we live our life, hoping that we'll have a well-being. So health literacy is not just a domain of textbooks or just a matter of reading an article, thinking like that. It's a collective effort coming from every aspect of society we live in. So it ties back to almost every other aspects of our life. We were looking into some of the COVID crisis in a country called Jamaica. We were impressed to see faith-based institutions were playing much bigger role to contain the social distancing. When I say faith-based, it's churches, religious institutions. They played a bigger role to educate people how to practice social distancing, how to take precautions, even promoting vaccinations. So it is connected more than just a healthcare experts. Obviously, it's connected to business industry, news agencies, all the other entities we surrounded by. So if you look at this slide, it's the health literacy is actually sits in the center of the entire society we live in. It has a very intrinsic relationship at a immediate level to a patient engagement, then it trickles out to interpersonal, organizational, community, and even to the point of macro policy level that brings it here. So why this public health has been such an elusive industry, and even implementing some of the public health measures seems to be challenging, because humans are pretty known to understand the uncertainty matrix is based on what we know for sure, which is known knowns. There are things that we don't know, known unknowns. There is also things that we don't know, we don't know. So that's kind of explains where the uncertainty comes in. So people who work in research industry such as me and Anil, and I'm sure most of these speakers have worked in research industry, we tend to go after understanding known knowns or known unknowns, such as like, we do phase 3 trials, phase 4 trials, which is just to establish, wait, smoking prevents lung cancer. Or we also go after phase 1 and phase 2 trials, trying to explore certain unknown things of what we think we know. But when you look at some of the unknown unknowns and unknown knowns, just as in COVID, as we going through this phase, we still not know what is its long-term effects. Currently, we are dealing with some knowns, which is cardiovascular effects. We are also dealing with some effects of COVID in pre-existing conditions, which we are exploring. But we will have to live through this phase through public health measures and through public health initiatives to understand a long-term effects of COVID. And that's where the public health measures and global health, community health, and education comes in. I mean, one of the biggest challenges, which we are all sitting, is a white elephant in a house, is mental health implications down the line. How are we going to quantify that? How are we going to measure that? What is the effect on society and young kids? That's where the public health education comes in. So the RAND Corporation, which is one of the leading nonprofit in the United States, as kind of reframing the health literacy as a public health issue. Low public health literacy has impact on both sides. It's primarily knows there is a human cost, which is hard to measure. There is also economical cost, which is if you don't take care of stuff, and there's going to be tremendous burden on economics of it, not just on an individual level, it's also at family level. At the end of the day, it comes down to the country level. So primarily, where do we understand this? In the simplest slide, I try to justify, okay, we have encounters, we have issues with the health. You go to a doctor and you just, what is your main problem? So someone is going to make a diagnosis. Then you will ask, what do I need to do? Then you deal with the treatment. So something is going to be written, or they will tell us something. So we're going to deal with the treatment. The last one, why is it important for me to do this? The context is where the biggest challenge we deal with. So where I see it, public health and public health literacy goes at the why is it important for me to do this? And that's a very challenging task for us to shape the context that is understandable to the audience or the customers or our clients or our patients. You could use any terminology you want. At the end of the day, we are trying to make the other person feel, live a better life. So quantification of public health literacy. This is pretty complex because we all look at public health literacy from different sides. What I think is public health literacy is different from what you think is a public health literacy. And also it goes to different countries, different cultures, different ethnicity. We all look at this concept completely in a different lens. For us in northeastern part of the United States, public health literacy is primarily driven by massive opiate addiction. To someone in Caribbean country, it could be just a domestic violence. and someone in South Africa or African countries, purely infectious diseases or air pollution in India. So somehow the scope of public health literacy is so wide, there's a lot of opportunities for all of us, whether you're a doctor or an engineer or nurse or anyone can look into to measure the public literacy as an outcome of health education, or you can look at it as a determinant of quality of health care, determinants of health outcome, or we can also look into the mediator aspects of health literacy in the course of time, which is temporally monitoring how health literacy can influence the outcomes. This is where I think the future generation, if the audience is interested to look into, get into the global health, there's a lot of opportunities to get in. And this slide kind of explains how the scope of public health literacy can be teased out in several ways. As the future graduating students or prospective candidates who are interested in global health, you could take the public health either through an emotion and promotion. So you could look into monitoring as a part of your journey. Health protection, you could continue to do diagnosis. If you're not a medical person, if you're not a doctor, you could actually use environmental health, occupational health to mobilize people, disease prevention to develop stuff. So you can see each one itself can develop into a massive community building, capacity building industry on its own, just using public literacy as a moderator, or we call it in research a marker, or even a surrogate marker to understand how to improve the quality of life. So we did some work. These are some of our publications that came out through our public health literacy. Ministry of Health in Jamaica accepted our abstract. We looked at perceived health concerns during COVID amongst Jamaicans, and it kind of gave us a very surprising insight how family health is number one priority than a personal health. 39% of the participants, they said their main concern is family health. That was an interesting finding for us to educate the society and the policy makers. They should invest more in family health instead of just talking to them on an individual level. We also published another one recently in tropical medicine and public health, and we compared two different countries. We compared Jamaica and Dominican Republic, and we discovered very interesting findings how two different countries, two different cultures looks at health risks completely in a different lens. We just put our manuscript accepted in Harvard Public Health Review, which is we wrote on social protection during COVID-19 crisis in India, especially among the vulnerable population. We found it, is COVID has actually deprived some of the social protection that's amongst people who are already been deprived before COVID. So these are the areas that where I see we do a lot of work. One thing I do want to share with the group here, you don't need to find a lot of funding, or you don't need to be, find multi-billion-dollar projects. Frugal innovation in public health. This was written by Aditi she's based in Switzerland. A great book for you to read. Just understand where you can fit in and try to influence in public health. Bottom of pyramid, there is 4 billion people in the world, and the challenges are heterogeneous. That's very important for you to understand. They are part of our supply chain in our entire society. There's a lot of issues about food, housing, education, and healthcare. The most important thing we need to understand, more lower in the socio-economical status you are, you're more to suffer. We actually call that as poverty penalty, which means it costs higher for you to live. As simple as you pay more interest rate to borrow money from local money lenders. And they tend to have a low purchasing power, so low demand. So most likely some of the leading business entrepreneurial companies, there are some good ones, they may not find it that lucrative to tap into these resources. That being said, I do think there's an amazing opportunity here, and I do think public health and global health will become more of a, I usually call more attractive or more in an informal way, I could even word it, it could be a sexy industry, just like plastic surgery or just like orthopedic surgery. So with that, I do want to thank you all for this time, and thank you all the group that have given me time to share my slides.
Thank you so much for that, Narayana Prasad. Really, it was so fascinating, and I was struck by a few things that you said, in particular that public health is ultimately personal. It is about the individual at the heart of the story, if you will. And from that, you can fan out to multiple levels higher up, all the way to government health systems and so on. But ultimately, it does come back to the individual. It comes back to individual rights and choices. It is linked, of course, to the social determinants of health, including socioeconomic conditions. You talked about the health poverty at the bottom of the pyramid that you just showed us. And you also spoke quite eloquently, I think, about the need to incorporate mental health increasingly into the public health sphere. And that's one area which has, I would say, long been neglected, but it is one that has also come to the surface very strongly amid COVID-19. There was a study done in the States which found that about 60 to 70% of all the health frontliners working on COVID-19 have, not surprisingly, experienced high levels of stress, mental health issues, which are still lingering even after they've taken breaks and they've stepped away. It is a post-traumatic stress situation that has been caused both for those who have been infected and their families, and of course those who have passed away and their families, but the public health frontline workers as well. So extremely important to weave it all together. With that is actually a good segue to our next speaker from the States as well, Dr. Gregory Fant, who is a public health epidemiologist and a longtime civil servant with the US government. And he's worked under many administrations. He's got multiple degrees, of course, and the breadth of experience has been vast in government. It's been under the Departments of Commerce, Defense, Health and Human Services, Veterans Affairs. And of course, I'm sure there are very strong lessons from the COVID-19 age as well. So with that, Gregory, can I just hand it to you for your own personal story and for your wonderful advocacy? Thank you.
Sure. Thank you, Roy, and thanks for the organizers for inviting me to participate in this World Health Day event, and thanks for all of you listening wherever you are in the world. How exciting! Yes, I'm Dr. Gregory Fant, and I'm here right outside of Washington, D.C. Isn't it wonderful about these virtual backgrounds? You can just pick whatever one you want, and then that's the way it will be. I've had a really good career, and certainly it began with a lot of preparation, right? Parents reminded me and my sister of the importance of education, and I went as far as I could. After the compulsory grades, went on to college, and then finished that bachelor's degree, and then a master's, and then a master's in public administration, because I thought health and public administration go together. And then a doctorate in really research methods, right? And epidemiology and biostats, because measurement is important for examining health and making decisions within government. And then earned a second master's degree as well in the health sciences and public health, because these things go together. And I've had a wonderful career in government, 24. and 24 years after finishing my doctorate as well. And so with that preparation and luck, I met Anil Burrowhead, and he had learned from some friends of mine that I had applied and been accepted as a Fulbright specialist candidate, and I was on the roster. And he thought, well, this was the type of person that he wanted to bring to India. And so I, in the federal government, I had earned a lot of vacation time. And I used some of my vacation time to do some volunteer work with the Jodhpur School of Public Health at the invitation of the Jodhpur School of Public Health. And I've been going back and forth once or twice a year since 2013. And thankfully, my wife and family have been very supportive of using some of my earned vacation time, not with them, but with some good people on the other side of the world, right? And really, really count myself lucky to be able to do that. And so that has been part of my story, right? There are two quotes that come to mind that have been really good for me in this phase and leading up to it. And one is from Gandhi, of course, Mahatma Gandhi, that said, you know, you have to be the change you wish to see in the world. All right, and so I thought about that. And then another one was from a U.S. basketball coach, John Wooden, who coached at one of our private universities in California, UCLA. And he is quoted as saying, when an opportunity arrives, it's too late to prepare. And so putting these two things together has really helped me, because I was at the right place at the right time with the right preparation. And I just had to believe that what I thought needed to happen and the contribution that I wanted to make, I had to be ready for it, and I had to prepare for it. And so it is in that context that I wanted to share. You know, I mean, every time I go back and forth to India, I'm actually pinching myself on my forearm, because I can't believe I'm being invited to use some of my time to help others in this way. And it's on those transcontinental visits, you know, that I've had an opportunity to think about. And so I'm going to switch over to my slides now. All right. And by the way, I don't have many of them. I certainly don't believe in death by PowerPoint. So let me see here. Just a second. I think I just messed it up. I think I have to share it.
Yes, you have to share it.
There it is. I think you guys can see it. Is that right?
Yes. Yes, we can.
Then let me switch it like this, so you can see the first slide, which hopefully is just the introductory slide, right? And that's what I wanted to reflect on. And the next piece is and by the way, I only have two slides. I'm sorry, five slides. And so these are the two things that I wanted to talk about with my friends on the phone now, or on Zoom. I originally thought this was just for India, but because of the poll we had at the beginning, I see that we have a lot of people from sub-Saharan Africa as well. So I'm going to make the link for us as we go along. All right. And so those are the two things that I want to talk about. In my flights and upon reflection, I realized that, you know, the WHO and the government of India have agreed that these are the things that they're going to work on for the next several years, right? And you can see that they want to work together on accelerating the adoption of universal health coverage for the population. They also want to promote health and wellness within the population by addressing the determinants of health. You can see that the third thing that they want to work on, they being the government of India and the WHO, is how do we better protect the population against emergencies, health emergencies. And then you also see that they want to develop global leadership, public health leadership within India for India and the region. And note where note where I got this. I went to the WHO website, looked for the government, looked for India and our work, and I just copied the things that they're looking for, right? So for those listeners who are not in India, but in other parts of the world, this is how I found it for India. You can do the same thing by going to the WHO website and looking for your country and finding the priorities that the WHO and your country plan to work on, right? So this is that first part of the preparation. And then you really have to think about it and just dream a little, because it's okay to do that. Where do you see yourself fitting in? We've heard from so many people already, and so many of the esteemed colleagues after me, that you don't have to be a physician or a nurse in order to participate in population health or public health. And that's what we're here to talk about. And so let's keep that in mind. Everybody is needed. Clearly, how could we communicate these ideas without some technology people helping us and allowing us to do this, right? Just as an example. So these are the areas that India and the WHO want to work on together, all right? And so my expertise happens to be in epidemiology and biostats and public health leadership, right? And so because I realize that measuring a health problem is important for allocating resources and to helping decision makers realize that that's where they need to invest their political capital, the human capital, and their economic capital, right? And so I can help do that by presenting good data and the analysis and interpretation of it. And so that's the first part. The second part is actually the preparation, right? And in my mind, it really does depend on how much education you have currently, how much can you earn or work on next, and let's keep it affordable. It is not necessary to go into hock, to take out so many loans or whatever, or to think that you can't do it just because you don't have all of the money now, And so I just think that if the interest is in program development and program administration in health and wellness, in immunization and vaccine preventable diseases and neglected tropical diseases and occupational health and safety, and let's not forget the importance of environmental health, right? That we have a master's degree preparation that is probably appropriate, right? And these are some of the things that some of the degree programs in India that might be interesting. I dare say that in other places around the world, this is what you're also looking for, right? If, on the other hand, your interest happens to be in program development and program administration in emergency response, public health emergency response, or in the public health supply chain management, or in disaster recovery, I think there's another level of preparation that is necessary. And here is what I think what you should be looking for, right? And if on the other hand, you are interested in applying in program it, and I have to move this, I can't even see I'm going to move your pictures. Looking at program administration and applied research for disease or health service surveillance, monitoring and evaluation of public health programs, looking at innovative ways to promote community health promotion, right? And what is the role that technology can play in helping us measure the burden of disease in a population, and how that measuring the burden of disease in the population can guide health planning and health administration, then perhaps we're thinking about a professional doctorate in public health and health administration, right? And that it's important to realize that being able to pursue these opportunities in your own country, right? not trying to take the Western model and dropping it in a particular country that is not Western and expecting it to work is probably not right. It definitely is not right, and it doesn't recognize the value that the culture and the history and the uniqueness of the various countries around the world. It doesn't recognize how that has a role to play in what we're trying to accomplish, which is ultimately improving the health status of a population where we live or in that region. There will be many people like me, like us that want to help. But in order to work in the public health arena at a global in a global way, you really can't do that from a developed country. You have to really do that in country where all of you are living. So we have to come to you, right? That's kind of where I am and how I think of it. And I think that certainly the Jodhpur School of Public Health and our many campuses, Empire School of the Empower School of Public Health and the things that they do, and others probably, if we're honest, around the world that want to help and want to participate. This is the way that we can all continue our professional development to make a contribution to this space that we call global health, this space that we call global population health, right? And so those are the 2 points that I wanted to make after giving a brief overview of how I'm coming to it. That's how I think about it. And thank you for letting me share this with you. And as we say here in Washington, D.C., where we have a lot of hot air, I'm going to return the balance of my time, right? So, Roy, there you have it. Thank you.
Thank you so much, Gregory. That was great. And you spoke about being lucky. I think, of course, we're all grateful for what life gives us, but I am not a believer in luck per se. I'm a believer in a calling, and I think the energy that one puts out there attracts one to where one is supposed to be as well. So I think it's a vocation, it's not a career, it's not a job, it's a calling. And I think that is true for perhaps many in the audience over here who've got the aspirations to be in public health. They feel it's a calling, it's actually calling out to them, which is why they are with us this evening, morning, afternoon, hearing these amazing stories that all of you have been sharing. So with that, I am going to go to our final speaker. Yes, actually, Paul will come back, but he's spoken already. So I wouldn't call him the final speaker, but the final new speaker is a remarkable person who is the head of a remarkable company called Telemedicine. And she is Ting Shi, the founder and CEO of Telemedicine. And I will let her tell you what Telemedicine does in detail, but in short, it is a company that connects healthcare professionals and patients in developing countries with specialist doctors and healthcare providers around the world so that the health outcomes are more optimal no matter where you are. So with that, Ting Shi, over to you.
Thank you, Roy, and thank you for all the other speakers, very inspiring stories. And hi, everyone. My name is Ting Shi, and my journey started, I think, less focused than all of you. I didn't even know I wanted to be in healthcare. I started out as in engineering, computer science. That was my undergrad. I grew up in Taiwan and moved to the US when I was just about 10 years old. And obviously didn't know English, didn't know what I wanted to do. And shortly after, I had to figure out a major in college, decided, math and science is much easier for me. So I chose computer science. And even after that, after I graduated, didn't really know how I could apply my skills as, in software development. I ended up working for the US Department of the Army. worked on streamlining weapon system development. I worked at NASA. I worked at Morgan Stanley. I worked at IBM. And eventually, I ended up working at a pharmaceutical called GlaxoSmithKline. That was probably the first time I felt really connected to the company's mission, which is to help people live better, healthier, and longer lives. However, what I was doing was what's called business continuity planning. So on the IT side, I was supposed to figure out all the different disaster scenarios that could happen and how it could bring down a whole drug company from manufacturing. So quite far away from the mission I wanted to be involved with. So I then applied to business school as a way to try to figure out, how do I switch career from technology, very technology focused areas, into something just completely different, something where I can be helping people directly and see those impact. So I went to MIT for dual degree business and systems engineering. And actually in my very first semester, I was in a class called Development Ventures. And the only assignment in the class was simply stated as create a business that will impact over 1 billion people. I thought, wow, that is so great. And, because it's a class, I thought, okay, think big, think what's possible. And certainly, and let me take you back in time, it was in 2007. Remember, back in time, there wasn't a smartphone, there wasn't an iPhone, there wasn't even an Android. We had those Nokia or KitKat bar phones. Some of you may remember them. So we thought, okay, well, regardless, most people in the world may not have access to clean water or even electricity, but we know they had access to phones, and more of them have access to phones. So why not use mobile phones as a way to deliver healthcare? And because most of these places don't have doctors, then we can use the mobile phone as a communication way, collecting medical information and transmit it to doctors so that patients can be anywhere and doctors can be anywhere. And hence started my journey of really figure out how to reach patients and create this health impact. So let me share some visuals with you. Let me just, okay. And I think you can all see it.
Yes, we can. Thank you.
Okay, great. And let me put this in presentation mode. Great. So this is the challenge I'm presented with, making healthcare accessible to billions of underserved. And obviously, and let me also emphasize, there is a prize at the end of the class, which is to submit our idea into the MIT 100K business plan competition, which would give us 30K if we're doing global health. If you're doing something business, otherwise not in global health, you could get 100K. So in order to figure out if our idea would work, we went to one of the ruralest places in the world to see if we could actually make it work there. And looking at the billion people population, it certainly is global from the start. So I went to Uganda, and so some of you are from Uganda, so this is no surprise to you, but absolutely a surprise to me in terms of, how do people live? And it took 8 hours to get there on, multiple transportations and bus, and 4 hours on a moped, and and most of you already know this. And people who are living there, it takes hours and hours to just get water, to just get food. And once they get to actual health facility, it's not any easier. It's a long way and not comfortable, and certainly a lot of inconvenience, and therefore a lot of people do wait till very late in order to get access to healthcare. So our solution is to create a technology platform that enables us to screen patients like her. In this particular example is actually in Botswana. And here we use a variety of mobile devices. And this, of course, wasn't 2007. We were using just a Nokia phone then. to collect information. And the way we collect information is similar. It mimics how a medical expert will ask the patient about their symptoms. What are you experiencing? What are you feeling? And then maybe capturing images and others. In this particular example, it was one of our first pilots as well. It was in Botswana. And as many of you know, really high HIV rate, about 40% in some of the urban centers. And we were trying to screen for cervical cancer from the women who are coming into the HIV clinics. And certainly you saw a lot of potential public health interventions there reaching women with cervical cancer. And it turns out HIV clinics is a really good place to try to engage them. So we screen for cervical cancer and taking pictures using the mobile phone. And all of that data is packaged together and transmitted to the women's health expert of Botswana. And then she would recommend treatments, and sometimes it's immediate removal of cancerous cells, and then obviously enable saving the life of those women right there on the spot. And as this went on, what we saw is the nurses, the frontline nurses who were using the mobile application were also able to learn to diagnose about 90% as accurately as the women's health expert in the country. And it only took about 2 to 4 weeks for them to achieve that level of accuracy on the diagnosis. And obviously they are the ones that were treating the woman, removing the cancerous cells, and educating the woman to let other women know how important cervical cancer screening is. And in that one summer alone, we worked with 96 women who came through, and a huge portion of them had cervical cancer and were saved. And obviously I was hooked. I didn't even know it was public health. I was doing public health in a way that was streamlined and fast and impactful. And we then expanded into oral screening. And in Botswana, there was only one oral surgeon for the whole country in the public government sector. And the oral surgeon was flown around the country, as well as patients being transported into the government hospitals for their care. And that amounted to over $1 million of savings just on transportation alone that the Botswana government was spending, and now could be done through mobile applications. And since then, the government of Botswana has established a mobile health institute, as well as a medical school. When we were there in 2007, there was no medical school. They established one to also include mobile health as a focus area due to some of the impact we're able to demonstrate. And obviously, why stop there? And this is, when I realized the impact that me as a technologist could have, there's no stopping. So we continue with a number of other diseases. So we start cervical cancer, oral cancer, HIV, dermatology, and extended into more chronic diseases, diabetes, heart disease, kidney disease, cancer, mental health. And when COVID came, we were very, very quick to adapt the system to screen for COVID. And as you know, COVID is such a classic case of public health, affected everybody in the world, and then needed exactly screening, be able to triage, know who needs to get testing, who needs to be hospitalized, and doing that very efficiently so that we don't overwhelm the hospital systems, leading to potentially more death rates. And we worked through a lot of different organizations, and I saw many of you come from many different backgrounds. Pharmacy was a big area as well. And certainly we worked through every segment, from the medical specialists to governments to nonprofits to now insurance companies, employers. And all of this is public health. If you are caring for the health of one person and thinking how it could work for everybody else, that's public health. And it's just so exciting to be involved with JSPH and all of the partners here in trying to help people realize what public health is and how the use of technology could also enhance public health delivery. I think another aspect of it is telemedicine. It's now the big buzzword because of COVID, but telemedicine has been around for more than 20 years. And we are now just starting to adopt. And I think public health has literally came into the limelight because of COVID. That was public health. And now everyone knows the importance of public health and what we can do and the importance of streamlining it, deliver better care and faster. And our platform connects the dots of what the patient needs, creating more or less a Uber-like experience whereby we know what the patient's needs are. We look at a population level data in terms of potential lack of access to care or even language barriers or lack of access to nearby hospitals or pharmacies, and connect the dots so that the patient can get the care literally in their homes or at a very nearby facility and at a cost that they can afford. And to expand this remote care model, we include point of care devices, which then extends what you can do just from video conversations alone, but into measuring your glucose, measuring your heart rate, measuring ECG, and caring for a number of disease categories and age groups, chronic diseases, infectious diseases, and maternal pediatric health. And obviously, as a computer scientist, I don't stream far away from artificial intelligence, but we are able to do artificial intelligence on data sets and start to make predictions of things like gestational diabetes, even before the woman shows any signs of possibly getting gestational diabetes. And that's where the wonders of machine learning and computer science comes in, and really bridging together all my skill sets and everything I've learned to really see what can be done in public health. And therefore looking at a health status progression of the patient, and then being able to intervene where you see prevent potential issues and improve the health of that person. And absolutely, if you're on this call, you're probably interested in healthcare, and absolutely possible to know better and more about public health and be able to make this impact for everybody around the world. So I want to thank you and hope you reach out and learn more about public health.
Thank you so much, Ting. That was amazing. And I don't know if you've been seeing any of the comments in the chat box, but there is a long wish list for you. I wish this innovation comes to South Sudan. Very interesting, great presentation, passion. Yes, I think it really jumped off the screen at us. And of course, all the speakers, the personal story, the passion, the way that you bring technology, not for its gee whiz effects, but for its sort of personal life-saving effects. And I think that is what really makes these stories so powerful. So with that, thank you so much. And last but not least, we go back to Paul, who will have a long-awaited announcement, which will be of huge interest, I think, to many of the audience. So with that, Paul, back to you.
Thank you very much, Roy. Can you hear me okay?
Absolutely.
Great. If I'm back, it seems there's a poll back as well. So the team's put one on. I think it's got 5 or 6 questions. Let's make sure everybody's still awake, and they are, because fantastic comments and incredible speakers, health literacy, health leadership, epidemiology, and of course, click medics with technology and machine learning. So if you could all just take a few moments to respond to the poll, and then I'll speak in detail about the course that we are jointly launching with JSPH, and some of the work that JSPH is doing in public health. And you heard Anil's story is significant. We are, and one of the reasons for the partnership is we are very strong in online digital learning and capacity building, where we've trained more than 200,000 people. And JSPH is extremely strong in public health partnerships within universities and working face-to-face, and also creating mentoring systems as well. And you'll hear that from Anil and others as well in closing remarks. We've got 62% who already will just wait till about 70%, and then we will close the poll. Okay, we're there. It's coming to 2 minutes, and why don't we close the poll now? Okay. So are you interested in a career in public health? 92% say yes, and obviously that is apparent if you've joined, and another 8% are already pursuing it. You heard about this through GSPH, Empower, and other channels as well, mostly through emails, more so than social media. And you are either a member, alumni, staff of GSPH, Empower. I saw several of our alumni on the chat as well, which is great. Purnima University, pharmaceutical societies, etc., etc. Okay, very good. And have you taken courses with us, with Empower? I think there's one with GSPH as well. Many of you already have. Large 2/3 no, but are interested. And you found, almost all of you found this extremely useful. Okay, excellent. So let's stop sharing this. And if you could put up my slides, I've got about 5 slides specifically about the course and helping the audience and those who are interested in building, shaping their career and entering global health in a meaningful way. Slides, please. Okay, great. So this is a 5-week course, and it's about international careers in global health and also in global health supply chain. So basically entering the global health arena. And whether you want to work for a Ministry of Health, and many of you already do, about a quarter of you do, a UN agency or a civil society, international NGO, this will guide you in a significant way. Next. So Global Health and Overview is the first module. I think there are 6 modules, and here we talk about defining and understanding what is global health, its importance, the principles of global health, the key concepts, and key healthcare sectors within global health. Next. Module 2 then is about healthcare systems, policies and management, and there are 4 sections here. Understanding the organization, overview of key health policies, the basic principles, and then the types of healthcare organizations, public, private, and NGOs. Next. Stakeholders in global health. Many of you have seen different brand names and different groups, but where and how do they fit in? What are their roles? How do they support the different elements of what makes global health work and tick? This, we put that in context in module 3. Module 4, what are the different careers in global health? And I think I mentioned earlier, you don't need to be a doctor or a PhD to work in global health. We also need people with a technology background, and you heard the story of Ting and ClickMedics. You could have people from advocacy and communications, from law, from finance. All of these individuals are working in global health, performing the necessary roles. There's a complete misunderstanding when people think that you need to be a doctor, a PhD, or researcher, and that you need to be in the top 1 or 2% of your class. That is not the case. And you heard many of the stories as well. Just that you know, give yourself the opportunity, understand what it is, and then build and shape your career in that direction. And this module talks about the potential areas of work, career initiation and progression in global health, and geography, where the jobs are available, and within those geographies, what are some public health concerns that need to be addressed. Next. Then module 5 talks about how to join global health organizations. Here there are 2 sections: how to build your profile to join global health organizations, and then studying global health, which there are so many different elements and ways of studying global health. It's not just one siloed activity. Next. And the final, I think it's the final module, is planning your global health career pathway. What are some examples? Here we talk about the different areas that you could be working in: medical, non-medical, research, and support and admin. And planning your section 2 is how to plan your career in the space. We give examples of CDC and the UN in terms of how this could be done, and then some useful resources for planning your career. Next. And when you're all done, you'll all get a certificate of completion from us for this international careers course in global health. Okay, it's purely and completely online, and depending on the size of the cohort, we'll also then do a necessary launch and a webinar launch when all the people have joined in as well. Next. To learn more about the course, it's already posted and hosted on our website. It'll also be hosted on JSPH, but the course is already running. We've already got several hundred people who are taking this course, and there are different topics and areas of interest as well that you might be. And I see many of you in the chat box are graduates of ours and alumni of ours as well. I think that's the last slide. Yep. Thank you very much. And again, we're really excited about announcing the partnership with Anil. We've been speaking for more than a year, and with Anil, I mean, he brings innovation, he brings passion. It's a journey that he's been pursuing for several decades, and we're honored to be a partner with them. Anil, a couple of words from you for closure would be great before we hand it back to Roy.
Sure. Thank you, Paul. This has been a great webinar today, and I think this partnership definitely will make something good for the humankind. And as Paul has covered everything he's mentioned about the courses, everything will be on the website, and we hope that you all are part of it from now on. And I think it's just the beginning today, and this will go forward. And I'm so privileged and thankful to all of you for attending this webinar, and special thanks to Empower to take this forward with us. Thanks again.